Hello everyone. So today here we are going to check it out the heart attack analysis with the help of Pandas data analysis and visualization. Here I'm going to use two libraries, Pandas as well as Seaborn and the Matplotlib library, which are going to be used for the visualizations here. Now, why I took the case study of the heart attack analysis? Because nowadays heart attack is the major problem existing into the world here. Number of people are suffering from the cardiovascular diseases here. So here we are having a data set. I just took the data set from the Kaggle and try to do the heart attack analysis and want to find out the insights that what are the basically input features we can consider through which we can detect whether the person is on the risk of heart attack or not. So let's take this case study. Let's move ahead. Cardiovascular disease. So the context of the particular case study is cardiovascular diseases are the number one cause of death globally, taking an estimated 17.9 million lives each year. That is accounting for 31% of overall deaths worldwide. 4 out of 5 cardiovascular deaths are due to heart attacks and strokes. And 1/3 of these deaths occur prematurely in people under 70 years of age. Because generally we know that people, if I talk about the nowadays, people are suffering for the heart attack nearby the age of 50, 60s, 70s. Even nowadays, it is going lower down into the 40s also. We had heard about a lot of heart attack people had suffered. Basically, there is one of the major reason for the heart attack is pollution. Global pollution is also the one of the major heart attack problems are there. Okay, so heart attack or heart failure is a common event caused by cardiovascular diseases. Now here I'm going to take this data set for which is containing 11 features, and here we are going to predict whether the person could be having a heart attack risk or not here. So here the people who are having problems or the disease pre-existing the diseases, so these kind of diseases could be a hypertension, diabetes, or hyperlipidemia, or any other already established diseases here. So we need to do the early detections and the management where we can predict whether the person could be having either heart attack risk or not. So inside the data set, I had took here attributes. These attributes are the input features where certain columns are present which are indicated various characteristics through which we can detect whether the person is at the risk of heart attack or not. So we are taking an age, gender, chest pain type. Now there are several chest pain types such as TA represent the typical angina, ATA represent atypical angina, NAP non-anginal pain, and asymptomatic. So here, resting BP, resting blood pressure, cholesterol, fasting blood sugar, resting ECG, max HR, that is the maximum heart rate achieved, exercise angina. Here, exercise-induced angina is there. Exercise-induced angina means chest pain after doing certain exercise. Old peak, ST slope, and this is the heart diseases. So these all are basically input features. I will say input features means here, these are the attributes or the columns which are requiring to predict whether the person could be having the heart attack or not. Let's talk about the heart diseases. Heart diseases, if we are getting the value as a 1, it means the person could be at the risk of heart attack. And if we are getting the value of 0, the person does not have any heart risk, basically. So let's check it out now, in depth now. Here I am loading particularly libraries which are going to be used for the data analysis as well as the data visualization here. So here I'm importing NumPy, Pandas, Matplotlib, and the Seaborn here. So these libraries I'm going to use for the Pandas data analysis as well as the Matplotlib and the Seaborn library here I'm going to use for visualization purpose. Let's load the data set here. I'm going to load the data set with the pandas.readcsv method, heart.csv. I loaded it inside the data frame here. We can see df.a head, which is going to represent here 5 top rows here, which is indicating age, gender, CP, and these are various input features which I told above here. These are the same features which are presenting here. Different values are here. Now let's see here, suppose age at the age of 63. If here in gender, we are getting a value 1, it means female. And if we are getting a value 0, it means male. So male and female. So it means here that any person at the age of 63 having this input features value is at the risk of heart attack. Yes. And the person at the age of 56 is having heart attack risk. Yes. Why? Because the values are 1 into the output. These are the heart attack values. So it means 1 means yes, the person is at the heart attack risk. Now I'm taking data frame.tail, which is showing me the bottom 5 rows here. Inside the bottom 5 rows here, it is showing, suppose at the age of 57, someone is not at the risk of heart attack. No. Someone at the age of 68 is not having heart attack risk. No, 0 value means no heart attack risk. I can move ahead with the df.sample here. 6 sample randomly here I'm taking. So one can see here into the output, either 1 is coming. 1 means yes, heart attack risk is there. No means no heart attack risk based on to the input values which we are capturing. Let's have certain more in-depth analysis, df.shape. So here we are checking out what is the number of rows as well as column. So here it is indicating 303 rows and 14 columns are present. Now I want to check it out here, whether this data set contains some null values or not. So as per dataframe.isNull.sum, it is indicating no, there is no data, no null values present here. Assume, suppose we are having any null value. So how are you are going to handle it? That one you are going to handle with fill NA, where inside the fill null values, we can fill the particular data set either with the mean or the median of that particular column. This we can use it. Or suppose I want to drop the null value, simply I will be using pandas method drop NA. With this, we can drop the null values here. df.info is going to give you entire information about the various column, the total number of rows, whether they are null or not, and that they are data type, as well as it is going to give you the memories as well, the how much memories you are containing. df.describe. This one is going to give you the statistical summary, entire statistical summary here it is going to give you. And here one can check it out. What is the mean value of each column? What is the standard deviation of each column? What is the minimum value? Suppose gender is there, so 29. There's any person at the age of 29 is present here inside the data set, and the maximum age is 77. These are the percentile provided here, and this one is the median value. These values all relates with the statistical summary. So df.describes gives the statistical summary here. df.column, it is going to give you all column names here. Now, if I'm looking here, data frame.head, data frame.tail, here we are getting all the columns displayed. I want to see or view only few columns here. What I can do here, I will be using either indexing or slicing, where I will be using location-based or index location-based functions, where I can control the total number of columns displaying here. So here I'm going to use data frame.location based, where I can see 0 to 10 rows, 0 to 10 rows, and also I can indicate which column I want to display it here. Inside the location-based or label-based indexing, we have to provide the names of the column here. So age, gender, and CP, they are going to be displayed here. Suppose here I want to check it out index location-based here. I do not want to use any names directly. I want to use the index location. So I will be using pandas index location-based function, where here I can just check it out 0 to 10 rows and 0, 1, 2 columns here. 0, 1, 2 columns are the same columns age, gender, and the CP. You are already aware here, such like I'm coming here. So basically, all these columns are automatically indexed. So these indexings, I'm going to pick it here, where I'm going to write here df.ilog. And inside the ilog here, I'm specifying 0 to 10 rows and column, which particular column I'm having, that is 0, 1, and 2. This one is much, much easier for us to check it out, which column I want to see with the help of ilog, index location based here. Here, 0, 1, 2, index location based here, I'm giving it. Okay. Even the same one here, if I want to give it here, 0 to 0, 1, 2, 0 to 3, if I'm giving it here, so 0, 1, 2, I can capture it here. Now here, let's say certain visualization. In the visualization, I want to see the age distribution. So cborn.hist plot df age. I want to see what is the age distribution going on here as per the data set. As per this data set, I can see maximum number of the people inside the data set is at the age of 60. So distribution says maximum people are at the age of 60 here as per the data set, 50 and 60. 60 are the more here. If I want to check it out the box plot of cholesterol level by gender, I want to see that which gender is having high cholesterol value as per the data set here. So for this here, I can see here, see this one, these values here. Here I'm just checking it out, cborn.boxplot, where I'm checking the gender as well as cholesterol value from the data frame here. So here you can see these values which are indicating as a 0, these are the male values, and this one is the female values here. So here we can see that maximum this one is the maximum, this one is the minimum. Maximum cholesterol levels are accumulated into the females as per the data set here. Male, inside the male, a maximum cholesterol levels are present as per the data set here, and females are having less cholesterol value. They are also having, but they are having less cholesterol value. Now here I want to do correlation matrix. I want to see the heat map here, correlation matrix here. So I'm just calling cborn.sns heat map here. And let's check it out here inside the heat map, what it is indicating. This one is a heat map here. We can just check it out whether the values are positively correlated or negatively correlated here. So here you can see these colors, If we are having these colors, lighter side colors, it means we are having a positive correlation. And here we are having negative correlation. So here, let's see this part now. This one. You can see the colors here, these colors. These colors are indicating that there is a positive correlation with the output. Output means heart attack or heart disease. And these show certain negative correlation. So here it is indicating chest pain. So this shows that chest pain, increased chest pain. If person is having increased chest pain, they are at the risk of heart attack. Okay. This value, thala-CH, this one is what? That one is the maximum heart rate achieved. So here we can just check it out that this maximum heart rate achieved and the target, they are also showing the positive correlation. So positive correlation here it is indicating that higher maximum rates might be having, here we can say, higher, you can see it here, higher maximum rate, higher maximum heart rate is a good indication of a means healthy heart, I can say, in a very general healthy heart. So it means if we are having higher maximum rate of heart, means here, just wait here, the terms are higher maximum rate achievement if it is happening. So it means that is a good indication of the heart normality. Heart is normal, I can say. If we say here certain another value such like SLP, slope is also there. Slope of the peak exercise ST segment it is as per the dataset input features. This is also showing here positive correlation, this value and this output. You can see the color. This is also showing you the positive correlation here. So what it is displaying here that this slope is indicating this positive correlation of the slope towards the heart is indicating that is showing the positive correlation that a flatter slope might be associated with a lower risk of heart disease. It means there is a lower risk of the heart disease with a flatter slope here. The values present inside the slope, it is showing that it is having a less risk of heart disease because it is showing here that there is a lower risk of heart disease. If we check it out, more values such as here, negative correlation with the target here. Negative correlation with the target here. Suppose here, this one we can see. Exercise induced angina. It means this is indicating negative correlation. It means here that if we are having exercise induced angina, so in that case here, we are having here risk of heart attack. If exercise induced angina is there, so we are having risk of heart attack. Okay. Like here, old peaks, some values are given here. Old peak also, you can see here, old peak, some old peak is there. So old peak is related, if as per the data set, if I'm talking about, old peak is basically ST depression induced by exercise relative to rest here. And if it is coming here in this color, black side color, so it is also a risk to heart attack it is indicating. Okay. CA, you can say some CA it is. CA is a number of major vessel colored by fluoroscopy. It means here, this is also showing negative correlation with the output here. So negative correlation here, it is saying that there is a possibility of a high heart attack. Okay, risk of high heart attack, it is going to give it here. Okay, in a similar way here, one can keep on detecting that whether if they're having a negative correlation as per the output is a heart attack. So it shows that these values could be indicating the risk of heart attack. Okay. So overall is there basically, this heat map provides a visual representation of the relationship between the different features and the heart disease risk here. Okay. So here we have to take that what could be the protective way through which we can avoid the heart disease risk basically. So we have to find out that what could be the protective factor means here, that how we can reduce down this heart risk here. Such like if CP is there higher, so it means chest pain is there. So chest pain is there. So it means high risk is there. So how we can reduce down this chest pain? So we have to do the work on to that part also. Okay. How we can lower down the key risk factors, that work we have to do. Now let's move further. If in case, suppose I want to check it out, what is the total number of genders, male and females inside the data set here? So again, I'm going to use cbond.count plot here, and through which here I'm just checking it out. You can see here, 0. 0 is mentioned here, that 0 is representing male and female. As per the data set here, female values are higher, about 200, and male values are nearby 100. 100 number of rows are the male, rest are 200 female data sets are there. Value counts, if I'm checking out pandas.value counts here. So here data frame gender.value counts, here it is saying 96 male, 207 female rows are present inside the data set here. Now here, if I want to check it out, the count plot for the chest pain, because there are different type of chest pains are there. So here it is indicating that there are basically 4 type of chest pain here. And majority is with a 0 type of chest pain, means here the people are suffering with 0 type of chest pain. 0 type of chest pain here, you can just go to the top and you can check it out. What is the 0 type of chest pain here? So here 0 type of chest pain is typical angina. It means they are having a typical pain is there. Okay, here we are, here. And this 1, 2, 3, so 4 types of angina, chest pain were there, so they are indicating. So, but majority one is a typical angina pain, it is there. as per the values indicating here. Then there are certain, if you know, there are other variables also, such like CP or FBS, it is mentioned here, or REST ECG. So we can just find out their value counts because they are again categorical variables. They are having, suppose, chest pain is there, so 0, 0, 1, 2, 3, different numbers of rows are provided with a different type of chest pain the persons are having. Same, some FBS value is present and the rest electrocardiogram values are also there. And so inside the value counts, one can get it out. There are details that how many rows are dedicated towards the rest ECG or not here. So 0, 1, 2 values are given here. If I want to plot the scatter plot here with the age and the cholesterol, okay, so that we can find out whether there is a positive correlation between the age and the cholesterol here. So that I want to make the this scatter plot here. So as per here, yes, it is indicating that there is a positive correlation. There is a positive correlation among the age and the cholesterol. It means as soon the age is rising, so your cholesterol is also increasing. Now I want to make the box plot here. So inside the box plot here, it is indicating gender and the cholesterol here. So gender and the cholesterol, if I check it out, so here it is also indicating that male candidates are having much more cholesterol as per the female candidates here. So cholesterol levels are higher in males, we can see it here. Now here I'm making the cross tab. Inside the cross tab here, we are just checking it out. Gender and the chest pain. Okay, I want to make a cross table for gender and the chest pain. That means gender is having what type of chest pain here. So 0 is means male, female. So if I check it out, male and the female here. So here it is indicating that maximum type of chest pain is 0 type inside the male and maximum type of chest pain is 100. It means inside the female, 0 type of chest pain is there. That is a typical angina pain, it is there. But other type of pain it is mentioning, they are lower. But in maximum, basically in female, typical angina pain is there. In male, typical angina value is there, but they are very less as compared to female. If I want to find out cholesterol by gender, what is the cholesterol present as per the gender? So here we are using the data frame group by gender and the cholesterol level, finding out the mean value. So here it is saying in male candidates, 261 is the average cholesterol level present. Mean average cholesterol level. In female, it is less. Now, if I want to find out that how many people are at the means people are greater than the age of 60. So here it is indicating these are the number of people greater than at the age of 60 here. So DF age greater than 60. So here it is finding it out all the people having the age greater than 60 and their correspondingly output values are there. Some of them are at the risk, some are not at the risk here. Here you can see if I want to prove certain multiple conditions, such as I want to see that in gender 1 means in females, I want to see all those rows with regarding to females and those females are having cholesterol level greater than 200. It means those females are at the risk of heart attack in a simple way here. So here it is just indicating that these are the ages which are greater. No, these are the genders. Female gender, female is it is, and their cholesterol levels are greater than 200. It means these people are at the risk. These people are at the risk majority because cholesterol level should be down in a person. If I want to find out the mean cholesterol level by gender, so here it is just giving data frame dot group by as per the gender we are trying to find out that mean cholesterol by gender. So what is that? Make the group of gender and find out cholesterol mean. So here 0 means here male. Males are having 261 cholesterol mean, high, very high. Similarly, there are other columns such as gender and chest pain along with maximum heart rate that I want to find out. So there is an aggregate function. I want to find out the mean and the standard deviation here for the gender with a chest pain with a maximum heart rate. So multiple aggregation, I'm doing it here. So their mean value and the standard values, we are getting it here. In gender, okay, in gender here, these are the different values as per the male here, as per the female here, and different chest pain values are there, and their mean and the standard deviations are giving in male case and in the female case here. Similarly, here I'm just making the pivot table here. I want to find out the values for the values here for the cholesterol. I want to find out the values for the cholesterol index. I want to make as a pivot table for the values for cholesterol, and I want to check it out as cholesterol value as per the gender here. Okay, with a different chest pain that I want to find out that what is the mean value of cholesterol along with the different genders and having different types of chest pain. So these values are coming here. So just like here, 267, let's see, suppose I say 267 is the value which is coming for typical angina chest pain in males. 243 is the typical angina chest pain in females. Similarly, 251 is the mean value in one, that is an atypical angina pain, chest pain type in male. 241 is the mean value of atypical angina pain in females here. Now here, Seaborn.box plot here, we are going to check it out. Box plot with the gender as well as cholesterol, or we can just check it out the pair plot of any three columns here. I'm taking age, cholesterol, and the maximum heart rate achieved. So here it is giving, this one already I did it here, box plot with Seaborn, I did it here. I can stop it if I want to stop it here. And here also it is just giving you the pair plot here. So here with the pair plot, we can get one thing, just like if I check it out the cholesterol and the age. So here it is indicating that basically pair plot we are taking with the multiple graphs here. So here with increase in age, cholesterol levels are increasing. Okay. This is indicating the level of cholesterol. Level of cholesterol 200 to 300. It is mentioning people are having 200 to 300 level of cholesterol here. Okay. Histogram with kernel density estimation. If I want to make a histogram of age with kernel density estimation. So here also we are getting that maximum people are at the age of 50 to 60. This indication it is giving 50 to 60. Maximum people are at the age of 50 to 60 who are at the heart risk, I can say. If I want to calculate mean cholesterol level by gender and I want to visualize it here, so the code is written here where we are just checking it out, data frame dot group by gender and find out the cholesterol mean here. And here we are making the bar plot here, mean cholesterol by gender here. So here also it is just giving you the mean cholesterol level as per the gender here. Values are given here. Mean cholesterol level 250 and here it is less than 250. So after doing this entire pandas data analysis, one is giving the recommendation that what could be the recommendation after doing this much analysis of the heart. So here we can see age and the heart disease risk are associated with each other. So here we can say the data set is likely shows a correlation between the age and the heart risk. Okay, as the age increases, the prevalence of heart disease tends to rise it here. What is the recommendations? The recommendations are prioritize regular health screenings and preventive measures for older individual, focus on early detections and risk factors here. Cholesterol levels, we have to manage it here. High cholesterol level is a significant risk factor. We already know that if we are having a high cholesterol level, so they are prominent towards the heart risk basically. Analyze the distribution of cholesterol level in the data set here and identify any pattern related to heart disease here. Now we can check it out. Encourage regular cholesterol checkups and promote lifestyle changes. Just like we have to think it on our diet, exercise to lower down the cholesterol levels here. And we have to detect the chest pain type also. That whether the person is having a typical angina or atypical angina means there are various types of chest pain basically. So we have to check it out, these part also, whether one is having a chest pain or not. So just to reduce down the chest pain, we can go ahead with less cholesterol level food or diets here. And we should promote the healthier environment or the exercise also. There are more recommendations such as carefully evaluate chest pain symptoms and conduct further tests to determine the underlying cause. Different types of chest pain may warrant different treatment approaches. We have to keep check onto the blood pressures also. High blood pressure is also major risk factors here. So analyze the relationship here, analyze the relationships here between the blood pressure and the heart disease as well. We can analyze here. So we need to monitor blood pressure regularly and encourage lifestyle modifications here. And here we have to check about the fasting blood sugar, exercise-induced angina, ST depression also, and other input features which could cause like heart attack risk. So basically, we have to work on to our lifestyle modifications, medications, and other suggested other suggestions which our doctors are preferring us here, okay, or our lifestyle coaches are giving us certain suggestions that how we can improve our better lifestyle so that we could be away from any kind of heart disease risk basically. So basically this is entirely a beautiful and good case study to understand that what could be the risk of heart attack and how we can prevent the heart attack on the early basis here. Okay, so this is overall. So artificial intelligence and machine learning are really helpful in healthcare sector here. Not only in healthcare sector, they are being helpful in all kind of sectors. Basically, nowadays, everywhere it is being used here. So hope that you had well understood about this heart attack analysis case study and you had learned a lot. Thank you very much. Thank you.